Hello, I'm Graham Elwood, and welcome to the Church of Batman. Today I want to talk about Obamacare. There was an article in the January 9th USA Today. I'm going to go through a lot of different media sources here, and just because I'm not endorsing, like wherever I'm getting an article, I'm just finding interesting articles and I'm going to talk about them. I'm not saying, oh, USA Today is the greatest source for news or it's awful. I'm just saying I get some news from there. This is an interesting story that's something we should talk about. So the title of the article is Mental Health Addiction Coverage in Jeopardy. Patients' lives hang in balance as Congress decides Obamacare's fate. Sherry Reynolds' son, Qual, has been drug-free for 16 months thanks largely to his treatment through Medicaid under the Affordable Care Act, which is Obamacare. Reynolds knows well what can happen when people can't get coverage. Her 20-year-old stepson, Jarvis, suffered from mental illness and killed himself in 2010 after he couldn't get medical treatment. Instead, he had been cycled through foster care and the juvenile justice system. Quote, I really hope they don't dismantle Obamacare, and I don't understand why they would dismantle something which is credited for saving so many lives, Reynolds says. As Congress works to repeal the Affordable Care Act with the support of President-elect Donald Trump, people with addiction and mental health disorders, their families, and treatment providers wonder how patients would maintain their sobriety and psyches without insurance coverage. The people helped the most by the ACA are the ones most likely to suffer from poor mental health and addiction. Nearly 30% of those who got coverage through Medicaid expansion have a mental disorder such as anxiety or schizophrenia, or an addiction in substances such as opioids or alcohol, according to the Federal Substance Abuse and Mental Health Services Administration. That compares with the more than 20% of the overall population, 68 million people, who had a diagnosable mental health or substance abuse disorder in the past year, the American Psychiatric Association says. So this is what Obamacare was set up for. I don't think Obamacare is perfect by any stretch of the imagination, but the goal was to just get it set up and then tweak it and improve it. I'll give you my personal Obamacare story. I'm self-employed, so I am responsible for paying my own health insurance. It's been over 10 years since I got insurance through the Actors Union, because I haven't. The Actors Union, you have to make a certain amount of money to qualify for insurance, and I haven't done that. Podcasting doesn't have a union. Neither does YouTube or stand-up comedy. So before Obamacare, I had Anthem Blue Cross. I was paying $459 a month. No joke. Very basic. I believe it was a PPO. For the same, almost the same coverage. I mean, they changed the name and the package of everything, but it's through Anthem Blue Cross for basically the same coverage. I'm paying $139 a month. That's $320 a month I'm saving. That's almost $4,000 a year that I'm saving. Now, I know some people say, Graham, I had to sign up for Obamacare and it's costing me more money. I'm not saying that everyone's getting what I'm getting. I'm just telling you, this is how much I'm saving. It's helping me as a guy that is a small business owner who's self-employed stay afloat. That's a lot of money a year when you're not making crazy money. So the fact that they just want to get rid of all of it and just dismantle it altogether is pretty. And of course, they don't want to help these conservatives. I love they call themselves Christians, but yeah, screw somebody with schizophrenia. Just pull yourself up by your own bootstraps. Okay, schizophrenics, pull yourself. Hey, Batman, just tell the Joker to just pull himself to not be so crazy and kill the citizens of Gotham. Looks like this guy's overreacting. This drives me insane. If you're a Christian, you should really want to help people that are less fortunate. A large portion of the homeless population are people with severe mental illness who aren't getting the correct treatment, and they're self-medicating with street drugs and alcohol. That's a large portion of it. The percentage of like, oh, they're just lazy bums living on the street is very, very small. Let's go back to the article. In New Hampshire, which has the highest synthetic opioid death rate in the country, Democratic Senator Jeanine Shaheen is reminding Trump about some of his campaign promises there. He pledged to take on this crisis, not immediately make matters much worse, Sheehan said Friday. Repealing the Affordable Care Act without replacement is highly reckless and will come at a high cost for people struggling with substance abuse disorders. Not to mention, I mean, there was a recent interview with a coal miner who is getting Obamacare and voted for Trump and is like, uh-oh, am I going to lose Obamacare? Yeah, maybe. Almost any route taken on Capitol Hill leads to an unraveling of addiction and mental health coverage for these people. Even the partial ACA repeal Congress is considering would eliminate the tax credits that reduce the premiums for about 85% of those who buy insurance on the federal and state exchanges. All right, well, there I got to come up with an extra $4,000 a year if that happens. Most of those who get tax credits pay less than $100 a month for insurance and have very low out-of-pocket costs that make it impossible for them to afford coverage. The partial repeal would scrap the expansion of Medicaid that gave millions of the lowest income people in 31 states insurance. Instead, states would most likely get block grants that would require them to make cuts in what's covered, how much is spent, and how many people can get coverage. Or states might get a set amount per person, but the overall goal is cutting spending to the poor and the middle class. Fuck them. You should have been, your dad should have given you $1 million, you fucking liberal crybabies. Jesus, out there protesting instead of having your dad, just have your dad give you $1 million like little Trumpy did. And then file for bankruptcy 6 times because the federal government takes care of rich people. The CEO of Thresholds, a Chicago treatment provider, Mark Ishang, said the ACA has been a game changer for those who are in and out of Cook County Jail. People in and out of jail, as you actually give them health coverage, they might get back into society instead of just being recidivists. Repeat offender. We're going to go through a couple states that are outlined here. In New Hampshire, repealing the ACA would cause nearly 120,000 people to lose coverage in the state. Where federal data shows a nearly 200% increase in overall deaths in the past 5 years. The heroin addiction is a serious, serious problem. And no, marijuana is not a gateway drug. Prescription drugs are. At the Cincinnati Center for Addiction Treatment, CEO Sandra Kuhn said about 30% of Kuhn's patients are covered for treatment because of the expansion. Overdose deaths climbed from 2,500 in 2014 to over 3,000 in 2015, up more than 20%. Overdose deaths in Kentucky have totaled 1,248 in 2015, up about 17% from 2014, according to the Kentucky Office of Drug Control Policy. Fentanyl, I'm sure I'm mispronouncing that, which is much stronger than heroin, was involved in 420 fatal overdoses in 2015, up 250%. Chicago, up to 30% of the 9,000 or more inmates at the Cook County Jail have diagnosed mental illness, according to jail data. With the ACA repeal looming, Sherry Reynolds worries about son Quayle, whose slide into mental illness and addiction began after Jarvis killed himself. Former Representative Patrick Kennedy, a Democrat from Rhode Island, author of the Mental Health and Addiction Parity Law, calls the ACA, quote, the best mental health and addiction bill ever. It makes his law's mandates real for more people, he says. All right, guys. Once again, this country doesn't want to deal with mental illness. It wants to sweep it under the rug. And since Trump is mainly voted by like old white people, they come from that generation of just suck it up, you know. People can't hold their booze, can't hold your liquor. That's not what addiction is. It is a physical addiction to something. Alcohol, heroin, or Oxycontin, which is just pharmaceutical heroin, and has now been prescribed for pain addiction, and then people scam that and sell it. Addiction is a brutal thing, and mental illness, again, we've talked about this on the PTSD episode. mental illness, I will quote my friend Paul Gilmartin, who has the podcast, The Mental Illness Happy Hour. He says, if you think you know about clinical depression because you've suffered from situational sadness, that's like thinking you understand Italy because you've been to the Olive Garden. That's my friend Paul Gilmartin's quote. If you don't have, I don't have clinical depression, so when I get down, I can just pick myself, I can't just go, yeah, I can just talk myself on, you can do it. Like, you know, Graham, get up, let's go, let's get to work, you know, stop belly aching. Clinical depression is a chemical imbalance that makes you think everything is awful. Or people have bipolar depression or mania, and their brain is constantly racing and you can't shut it down. And, you know, as I've talked about before, the medical community is just barely understanding the human brain. And Obamacare actually helps people. That's what you should be doing as the richest, most powerful country in the history of the human race. We should be helping people, not giving tax cuts to companies. Like, oh wow, Carrier saved 700 jobs that were going to go to Mexico. They needed a $7 million tax incentive, a company with a $4.5 billion profit. Hey friends, take a little bit of those billions of dollars and maybe keep some jobs here if you help that. You know what I mean? Throw some money into mental illness. All you rich companies, all you Trump supporting assholes, you should help people that were, can you imagine just being born with a mental illness? Your brain just doesn't work like everybody else? You need help. The government can help you. This is Graham Elwood for the Church of Batman. Contact your representatives, guys. Don't let them repeal the Affordable Care Act. I didn't know who my representatives were. So I went to Senate.gov and found out who my senators were. Each state gets 2 senators. They're Kamala Harris and Dianne Feinstein. And I have 1 representative of Congress because that's the district. You have one, whatever district you live in. My congressman is Ted Lieu. So go to House.gov and Senate.gov and find out who your representatives are. Once you find out who they are, they have a website. You can go right to that representative or senator's website and email them or phone call them and tell them what is important. Take charge, guys. If you're busy, you got 3 jobs, I get it. That takes 5 minutes. Take 5 minutes. This is Graham Elwood for the Church of Batman. Make Gotham great again.